Today we've got another setup, class 1 relationships, which is good for us. Some mild crowding, some space insufficiency in the frontal area on the lower jaw. So we're gonna do some IPR and expansion. So let's begin. Should be a quick case. Change local origo. I'm gonna make some minor expansion, preserving the existing rotations, so I don't care much on the axis of the posterior teeth. But for the anterior teeth, I have to be very accurate and fix all the imperfections my technician could left for me. Well, short roots, good for us. Done with the upper. Okay, the same protocol for the lower jaw. And carefully check all the incisors. Okay. So since I'm going to just expand, I ignore the roots anatomy when setting the axis of the posterior teeth. In case if I distalize or rotate or I don't know, intrude, I follow the roots anatomy, but now I don't. Then we go to virtual setup. And as I usually do, I start with the expansion of the lower teeth. So I don't expand the second molars because it's just impossible for aligners. But I make some expansion for premolars and the first molars. Yes, once we see some gaps, we close them with some distal tipping of the first premolars. We can also add some distal tipping to the canines. So we can add distal movements for not more than 2 teeth on each side for each layer, since we need some anchorage. And we're expanding the frontal teeth. We're making some proclining, combining the torque with rotation. For this case, we have pretty big crowns and quite short roots, so we can even exceed the rotation over the torque in case if we need it. I think we do. Distribute the gaps between all the insiders. Checking if we're still inside the bone. No, we aren't. So let's reduce it a bit. We don't want to get the recession. Let's go to the upper jaw and do the same. Add some buckle movements. Now let's work with the individual teeth. Aligning them to the straight position to each other. Now we expand and rotate the frontal teeth as well. We need to get some sagittal gap so that the lower teeth can be set to the desired position, which we programmed here. So we need to create some sagittal gap for the first layer. Okay. So now we can proceed. Let's make the second layer. Oh, here the rotation exceeds torque for a lot. So let's reduce rotation, increase the torque. So let it be 3 and 3 degrees. These numbers are valid only for the case when we set the center of rotation in the middle of the root. This is what I actually do for all the aligner cases, because this is how aligners work. They don't move the teeth with bodily movements. We always tip the teeth. And the rotation center is in the middle of the roots for most of the cases. Not for all of them. but for, let's say, 90%. Okay. This is the biggest issue here. How can we rotate this lateral incisor? Of course, we do need some round tripping, but we are limited in it because we have a thin bone here. Let's remove the transparency. Yep. We have to be slow. All right. Layer 2, layer 2. Now make some retraction using the tipping movements as we usually do. Oh, the gap is too big. So let's move the incisors towards it to close the gap. And never use translational movements for moving the incisors to mesial or distal direction. You have to use only tipping if you want to get a realistic setup. Yeah. Here we have to combine the work with some body movements. So if we do, we have to add some intrusion. If you want it to be for real. So in this case, we should add intrusion to the other teeth as well. I don't think we can intrude the canine. I think it's physically impossible for this case. So we'll leave them as they are. Okay, let's go to the lower jaw. Distal and lingual tipping. Some quite significant IPR. And lingual tipping of the incisors. Now we get some contacts. So we need to intrude as well. And combine the body retraction with the tipping. Let's make the final adjustments of the positions of the incisors. We should definitely use Endura FLX plastic for this case to let the rotations work Maybe even add some 0.5 millimeters. Let's say every 4 or 5 steps. Now we got some sagittal gap. We'll try to close it. How can we do that? First of all, we can reduce the intrusion. Making the final adjustments. I always leave some sagittal gap. I think it's good decisions for most aligner cases. And we must aware the patient that we need a permanent retention. Like he has to wear retainers as long as he wants him to, as long as he wants his teeth to be straight. Because we had a stable position, the teeth were, I don't know, crooked, not aligned, but it was a stable, functional position. Now it's not stable at all. So for the stability, we need to wear the fixed retainers or fixed plus removable retainers. This is what I usually prescribe to my patients. All right then. Oh, I don't like this contact. Yes, I have to do something to the canines. Now it's much better, in my opinion. Same here. Maybe I'll ask the doctor to grind the incisal edges. Oh, I don't like this collision. How was it in the start? Yeah, it was tight. It was tight. So we have to grind it. Yep. We have to take a diamond burr and grind this edge before we start treatment. Otherwise, this lateral will not be lined because it's blocked by its antagonist. Okay, let's put the attachments on. To rotate the canines. 7, 3, 5. Not much. So I'll put the attachments for retention to the canines. And first premolars. I'll use this shape. I like it a lot. And same for the lower teeth. I'm going to add some more retention for the first molars. So I'll use the second shape, the rectangular one. I'll put the numbers, not to forget it later. Well, do I need any other attachments? I think yes, I do need the negative ones or some incisors. Let's see which ones. First of all, I'm checking the overcorrection. Okay. So on the first layer, I'm going to put two negative attachments to help the lateral incisors to rotate while they're going forward. And at the second layer, we'll do the opposite, putting these attachments to the distal part of the lateral incisors. Okay. Let's check the overcorrection once more. I think I should fix it a bit. And let's add a negative attachment here. It shouldn't do any harm. Right, let's see how many liners do we need to make. Should be around 15 sets of trays. Nope. 10 for the first layer. Oh, 10 for the second layer. 8 for the first layer. Should we make even more? 0.24, but we move the canines, which should be 0.2. So I think 8 should be fine. And here, yep, 10. I think I cannot reduce the quantity of aligners here. Let's check the animation. Yeah, that's what I like. No mesial distal interference. Safe for IPR techniques. Okay, 7. And yeah, let it be 7. So how many in total? 32. Yep. Let's see the animation. Yeah, it's a very typical case for aligners. The biggest problem here is the right lateral incisor on the lower jaw. We can have troubles rotating it. So that's why the rotation is a bit incomplete on my setup. I'm absolutely sure that we cannot rotate it for more than this without using the chains and buttons.